Millions of people infected with COVID-19 have side effects for months after contracting the virus, and for some that includes psychosis. Doctors say this condition is even occurring in coronavirus patients that have no pre-existing mental illness. For more on this, I want to bring in Dr. Daniel Bober. He is a psychiatrist and a former mental health policy fellow in the U.S. Senate. Dr. Bober, welcome. What are some symptoms of psychosis, and how often does it occur in people diagnosed with COVID-19?
So there was a study that showed that relatively a third of people who suffered from COVID-19 have some sort of neurological or psychiatric diagnosis, such as depression, anxiety, insomnia. Psychosis is a relatively rare phenomenon. There's very few people that are getting it, maybe a handful. But some of the symptoms include hallucinations, meaning hearing things or seeing things, delusions or false belief. For example, I had a patient who was suffering from COVID-19 psychosis who believed that people were watching him and following him and investigating him. So the symptoms of psychosis that we're seeing are very similar to things you might see, for example, in people who have schizophrenia or a drug-induced psychosis.
Well, do we know, doctor, what are some reasons why a COVID-19 infection might cause psychosis?
So we don't know what the reasons are yet, but we know, for example, that the virus crosses the blood-brain barrier, so it may be a direct effect of the virus, or it could be an immune system overreaction that produces inflammation in the brain. It could also be a vascular complication, for example, what we're seeing with blood clots. So there's many theories on what cause it. And for example, there's also a theory that some of the drugs that we actually use to treat COVID-19, for example, steroids, which we've heard so much about, can actually cause psychosis as well. So it's probably multifactorial in origin.
And do we know why psychosis occurs in some coronavirus patients and not others? I mean, are certain demographic groups more likely to experience this?
So this is not the first time this has happened. We've seen this with the 1918 flu pandemic. We've also seen this with other coronaviruses. But people who have pre-existing mental illness also seem to be at greater risk, although there are people that develop psychosis after COVID-19 that have no history of mental illness and have no mental illness in their family. So that's obviously very concerning.
And I know the science is still emerging on this, the research is still developing, but if someone develops psychosis after contracting COVID-19, how long should they expect it to last? Are there any indications, and what are some treatment options?
So generally what we've seen is that it lasts a few weeks and tends to resolve. And again, just like we treat schizophrenia with antipsychotics, we also treat COVID-19 psychosis in a similar fashion, and it tends to be responsive to those types of medications.
And for people who are listening, doctor, I mean, you touched on this a moment ago, but what other mental health illnesses have been linked to COVID-19?
So there's been an increase in depression, in anxiety, and insomnia, and dementia. And these are also first psychiatric diagnoses for a lot of people. So these are people that had no mental illness prior to getting COVID-19 and then developed it afterwards. So that is a lingering, symptom of the illness, which is obviously a major public health concern.
Right, and something people should be aware of, that it is in fact something potentially linked to COVID that they can talk to their doctors with, at greater length. Dr. Daniel Bober for us. Dr. Bober, thanks very much for sharing your insight and expertise with us.
My pleasure, Elaine.